Hi everyone. So today's video is all about contraception. So contraception refers to temporary or permanent measures to prevent conception or pregnancy. So that is called as contraception. So why the couples have to undergo the contraceptive methods? What is the use of contraception? So generally, in case of the India is said to be the second most populated country in the whole world, which means the population explosion is being occurring in case of the India. So thereby, to have a control over the population explosion, the couples, the newly married couples, have to utilize the various of the contraceptive methods where they can prevent the pregnancy, right? So in case of the contraception, there are two modes of contraception. First one is called as a temporary contraception. The other one is called as a permanent one. Temporary contraception generally includes the natural methods. Thereafter, we have barrier methods. Next is IUDs, pill method, chemicals, injections, implants, and emergency contraceptives. And the permanent method of the contraception includes the one which is called as the terminal method or the sterilization methods, which includes vasectomy as well as tubectomy. So in this video, we will be discussing only about the temporary methods of the contraception, where we will be discussing in detail about the natural methods, barrier methods, as well as the IUDs. So to begin with, the contraceptive methods, which are the temporary methods of the contraception. The first one is the natural methods. So in case of natural methods, the couple need not utilize any kind of a barrier or a chemical or a pill, but even they are able to have a control over having the children in their family. So temporary methods are those generally which are being necessary to have a space between the first child and the second child. Henceforth, temporary methods are also called as spacing methods. So let us start with the natural methods, where there is no need of usage of any of the barriers or chemicals. So naturally, the couples can prevent the conception or the pregnancy. So in case of natural methods, there are three types. First one is a periodic abstinence. Second one is a coitus interruptus. And third one is called as lactational amenorrhea. Where in the first one, that is called as a periodic abstinence, or it is also called as a safe method or a calendar method or rhythm method. So in case why it is being called as a safe method or a calendar method is, here in this particular method of the contraception, a female should be very much aware of her menstrual cycle. That is, generally in case of a menstrual cycle, as you know the phases, that is menstrual phase, follicular phase, ovulation, and the luteal phase or a secretory phase are being present, where the ovulation is a particular phase which occurs on the 14th day of the ovulation. That 14th day when the secondary oocyte is being released. So by chance, if that secondary oocyte comes in contact with that of the sperm, then there is a possibility of the pregnancy getting confirmed, because fertilization occurs. So to avoid that, how it can be done, how this periodic abstinence can be done. So in case of prior to having to that of the sex, okay, the female should be aware of her menstrual cycle, and the couples can participate in the sex, that is before to that of the 10th day and after to that of the 18th day of the menstrual cycle, where that particular phases, that is before the 10th and after the 17th or 18th day, they are being considered as the safe period, whereas the 10th to 17th day which is being present, that is regarded as a fertile period. what we are focusing here is about contraception, which means the couples, they should enjoy their sexual drive, but the female should not get conceived. So if the couples avoid having coitus between 10th to 17th day of the menstrual cycle, possibly the secondary oocyte will not come in contact with that of the sperm, thereby the periodic abstinence method is being successful in case of the contraception. Okay, so why only the couple should avoid having intercourse between 10th to 17th day is because generally the ova, which is the secondary oocyte which is being released from the ovary, so that has a lifespan of around 12 to 24 hours roughly. So that is very much present, and in case of the sperms are very much active up to 3 to 5 days. Okay, so possibly if the male inseminates in the female reproductive system on the 12th day, for example, 14th day is the ovulation. So 2 days prior to that, if the sperm is being introduced into the female reproductive tract, as the sperm lifespan is 3 to 5 days, so possibly on the 14th day, the sperm may come in contact with that of the ova. Henceforth, there is a possibility of conception. So, the couple should avoid having a coitus between 10th to 17th day of the menstrual cycle. If they avoid, and if they practice the sex prior to the 10th day and after to the 17th day, so there maybe the couples may be successful in contraception. So that is the first one, periodic abstinence, where the periodic abstinence here refers to the period is nothing but it is being regarded as the menstrual cycle, that is a period. So abstinence means generally it is making the block, right? So the next one is coitus interruptus or withdrawal method. So here in case of the coitus interruptus, see the word itself is suggesting that the coitus is being interrupted. Okay, or it is being called as withdrawal method. Why the withdrawal method? So this is being commonly practiced by the males. So here the males should be very much cautious about releasing or inseminating the semen into the female reproductive tract. So in the earlier one, female has to be very cautious. In the second one, it has the male should be very cautious. That is, whenever the couples are being practicing in that of the intercourse, at a particular moment, the male will feel that at this moment there will be the releasing of the semen. So at that particular moment, the male has to withdraw his penis from that of the vagina, and ejaculation of the semen has to be done outside the female genital tract. So when the semen is not entering into the female reproductive system, possibly the sperms may not enter into the female reproductive system, thereby possibly there is no fertilization or the implantation. Thereby, by using this particular method, contraception can be done. But coitus interruptus has a disadvantage. So what actually happens, or how the disadvantage is there associated with coitus interruptus is, for example, if you consider this as a urethra, okay, so lining this urethra, okay, lining the urethra is being seen that along with the urethra here on the either sides there are presence of the Cowper's gland. So what does this Cowper's gland do is they release the mucus prior to the or before to that of or during the process of lubrication, sexual intercourse, the mucus is being released, and this mucus lines to the lining of the urethra. Now what happens is, if before to the intercourse, if the urine is being discharged through that of the urethra, so that urine droplets, when they are being deposited, so that urine droplets may kill the sperms, because the pH of the urine is around 5 to 5.5. So that will kill the sperm. So when the mucus is being released by the bulbourethral or the Cowper's glands, so that mucus neutralizes the acidic urine which is being deposited in the urethra. So what happens is, once there is a deposition of the mucus, the semen, when it is being released, there the semen which contains millions of the sperm, so some of the hundreds of the sperms may get deposited in this mucus which is being deposited over the urethra. So during the first sexual practice, the male ejaculates the semen outside the female tract. So at that particular moment, sperms are being attached to the mucus, right? But if that male, if again he copulates with that of the female for the second time, so this mucus which is being deposited, which contains the sperms, so that mucus now, second time, the mucus will enter into the female reproductive system, and that mucus consists of the sperms. So possibly that sperms may enter into the female genital tract, and possibly fertilization may even occur. Henceforth, that is the only disadvantage which is being seen in case of the coitus interruptus or withdrawal method. Next, lactational amenorrhea, or it is called as breastfeeding method. So here lactational, so lactation basically, as you know, just after 2 hours after the parturition, the lactation process will start, that is production of the milk, and releasing of the milk occurs. So that is what we have discussed in the earlier videos. So that lactational period generally has a high concentration of the hormone that is called as prolactin. So this prolactin, when the concentration of the prolactin is extremely high, this prolactin is antagonistic to the gonadotropin releasing hormone, which means if prolactin levels are high, GnRH levels are low. So when the GnRH levels are lesser, there is no releasing of the follicle stimulating hormone or the luteinizing hormone from the anterior pituitary. So as you know that FSH is being necessary for follicular development and LH is necessary for ovulation. So when there is no FSH and LH, so further there is no follicular growth as well as its release. So that is being completely inhibited. So which means that whenever the prolactin levels are high in case of the mother, lactating mother, so GnRH levels are absolutely low. So during that particular time, if the couples are being involved in the sex, so if the male inseminates also, as there is no release of the secondary oocyte, possibly there is no fertilization, and henceforth that acts as a contraceptive method. And this particular lactational amenorrhea, you know, means your absence, and menorrhea is basically the menstrual cycle. So during the lactation period, there is no menstrual cycle, and this particular method, it is very much active up to the 6 months of the initial lactation period. But thereafter what happens after 6 months, okay, after the lactation has been started, there is a decrease in that of the prolactin levels. So when the prolactin level starts decreasing, the GnRH level starts increasing. So possibly after that 6 months, the ovary may start showing the follicular development as well as the ovulation may even occur. So after 6 months of the lactation period, if the couples participate in the sex, possibly there may be that female may again get conceived. Okay, so that is restricted, confined to 6 months. Okay, and next, this is all about the natural methods, where the first one is a periodic abstinence, second one is a coitus interruptus, and third one is a lactational amenorrhea or a breastfeeding method. Next is a barrier method, where barriers are basically the physical devices which are being preventing the contact between the sperm as well as the ova. So when the sperm as well as the ova are not able to meet, then there is no fertilization, henceforth no conception, right? So in case of barrier methods, which are being also called as the physical methods, so there are 5 different types of the barriers which are being present. The first one is called as a condom, second one is called as a female condom or femidom or femshield, third one is a diaphragm, next is a cervical cap, and the last one is vault cap. So these are the 5 barrier methods which are being used by males as well as the female. Okay, let's get into detail. Condom basically is made up of a latex sheath, and this condom is rolled over the male copulatory organ, penis, prior to the sex. So when the condom is being rolled over the penis, so during the process of intercourse, okay, as it is being rolled over the penis, during the process of intercourse, when the male ejaculates his semen, so that semen is being collected in that of the condom itself. So the semen which contains the sperms are not allowed to enter into the vagina or female genital tract. Thereby it blocks, okay, it blocks the entry of the sperms into the female reproductive tract, right? So that is a condom, and a very common, very popular brand which was being was there, that was called as NEET. And in case of condom has two main functions. First function of the condom is it prevents conception, and second function of the condom is it also prevents the user against the various of the sexually transmitted diseases. So those are the two functions of the condom. Next is female condom. If the male is not being using the male condom, the female can use female condom, or it is called as femidom or femshield. So there is a difference between the male and female condom, where male condom is having a single opening, whereas in case of a female, there are female condom, there are presence of two openings, where one opening covers the exterior part of the vagina, whereas the inner opening will goes and it will attach to that of the inner lining of the vagina. So prior to the sex, if the female uses the female condom, and if possibly the male releases the semen, so that semen gets trapped in that of the female condom, and thereafter the sex, the female has to take out that female condom and it has to be discarded. And remember, both male and female condoms which are there, so those are single use. You cannot reuse it. So they are only for single use. Next is diaphragm. So diaphragm, cervical caps and walled caps. So generally these are to be retained in the female tract even after 6 hours after the coitus. So after 6 hours, the female has to take out these diaphragm and they have to be discarded. And very important thing is, diaphragm, cervical caps and walled caps become very much effective when they are being used along with that of the creams or jellies or paste, okay, because those creams, chemicals which are being present, so they are spermicides, okay. So there, when the chemicals along with that of the barrier methods, when they are being used, so then they become much more effective in preventing the conception, right? So diaphragm is basically to be introduced into the uterine region, very close to that of the uterus region. Thereafter is the cervical cap, which is a hemispheric dome shaped structure, and walled caps are cervical caps are the miniature of that of the diaphragm, and walled caps are the hemispheric dome shaped structures which are being used only by the females, okay. And these all 5 different barriers which are there, all these provide privacy to that of the user, okay. And among the 5 condom and female condoms which are there, so they are to be used single, whereas diaphragm, cervical caps and walled caps can be reusable, okay. And you see, the diaphragm generally is this like structure where inside it is hollow, so where a female can take that jellies, okay, or it may be the cream or foam, so that has to be applied inner to that of the diaphragm, and thereafter it has to be inserted. So that makes very much effective of preventing the contact between the sperm as well as the ova. So that is a barrier method or a physical method. And the third one, that is called as intrauterine devices or IUDs, or they may be even called as IUCD, where it means intrauterine contraceptive devices. So, intrauterine devices may be made up of a plastic, or they may be even made up of the stainless steel, and they are impregnated with that of the barium sulfate. And there are different shapes of the IUDs. So IUDs may be of the loop shape, spiral, rings, bows, as well as shields. So they are different type of the IUDs in their shapes. Now, among the IUDs, the most preferable contraceptive method by the Indian female, so those are the IUDs. So in case of IUDs, there are three different types. The first one is called as a non-medicated IUD. The second one is called as a copper releasing IUD, and the third one is called as the hormone releasing IUDs. So in case of the non-medicated IUDs, so non-medicated IUDs are generally regarded as a first generation IUD, whereas copper releasing IUDs are second generation and hormone releasing IUDs are the third generation IUDs. So let's get into the detail how actually they work, what are their functions. The first one is non-medicated IUDs. So where we have a common example, that is a Lippes loop. So you can see the structure. So this is the Lippes loop, and does not contain any kind of the hormones in it, or even the coppers are totally absent. Then how does Lippes loop prevents the contraception? That is, this non-medicated IUDs have various of the function. One such function is impairment of the sperm ascent, means the movement of the sperms, so that is being reduced by that of the Lippes loop. Quick tubal motility. So the once this IUD is being introduced into the uterus region, thereafter what happens is even the fertilized egg, if it is there in that of the fallopian tube, when these devices are being introduced, so the fallopian tube will start making the movement. That's what I said, quick tubal motility. So that fallopian tube, when it makes a movement, excess of the movement, the fertilized egg which has to get implanted on the uterus on the 7th day, so that fertilized egg will be sent out very quickly before the endometrium receives the fertilized egg. So that fertilized egg, instead of getting implanted, it is being sent out. So that is why this particular IUD will prevent the contraception. And the last one is histological as well as the biochemical changes occurs in that of the endometrium, and when those changes are being brought about, implantation is not being seen. Conception is being prevented. Right. Next is copper releasing IUDs or second generation IUDs. So these are the IUDs which contain copper. Okay, and copper is meant for suppressing the motility of the sperms. So these copper releasing IUDs contain copper. So around 50 μg, you can see the examples I have written there. One is copper T, the copper 7 and multi-load. So there you can see that there are presence of the copper. The copper ions are being deposited over these devices, and once after it is being inserted into the uterus, daily at an average of around 50 micrograms of the copper ions will be released. Continuously they will be released. So during this process, when the copper ions are being released, if there is insemination, so these copper ions will suppress the speed of the sperms. So henceforth they may even prevent the contact between the sperms as well as the ova. That is one thing. Second function is copper has a local anti-fertility effect. Means whatever the effect the copper has to show, that is being confined to that of the uterus, where this will be there because of the release of the cytokines. So cytokines prevent the movement of the sperms towards that of the uterine region. Okay, so this is copper releasing IUDs. Now among the shape, as they are appearing in their shape, the names are being given. So this appears like T, henceforth it is being copper T. The other one appears like word 7, so that is a figure 7. So that is why it is called as copper 7. And this is a multi-load. Multi-load in the sense, you can see here, there are many number of the loads are being seen where they may contain the copper ions. And it may be even named as 280 and 380. So 280 and 380, the names are being given because this particular around 280 mm or 380 mm, what is there? So that mm of the place of the device is being covered by that of the copper ions. So thereby the name is being given. And all of these have lifespan. For example, a copper T, copper 7 will have a life of around 3 to 5 years, whereas the copper T has a lifespan of around 6 to 8 years. So a female has to remove, okay, a female has to visit to a doctor who has inserted these devices, and she has to remove after the completion of their lifespan. So why it is so? Because once after they complete their lifespan, they are unable to release the copper ions. So thereby they have to be removed. If not, what happens? Maybe possibly infection, it may occur. Because the copper ions, for example, if this is a copper T, so on this particular device, when the semen is being introduced, semen contains calcium. So that calcium starts depositing over the device. So this deposition of the calcium prevents the release of the copper ions. So thereby they lose their lifespan, and thereafter they have to be removed. And still, if the female wants to continue, okay, the contraception, thereafter that female has to go with the new devices of either it may be copper T or copper 7, or it may be the multi-load, right? Next is the very interesting one is the hormone releasing IUDs, they are also called as third generation IUDs. So here the examples are, one is LNG20, which means LNG refers to levonorgestrel, and it is the other one that is called as progesterone. So here both the devices are being involved in releasing the hormones such as progesterone mainly, or we can call it as progestogen or progestin. So they are being mainly present in that of these hormone releasing IUDs. And progesterone or progestogen which is there, so that inhibits the activity of LH. Progesterone, progestogen, progestin inhibits the activity of LH. When the progesterone levels are high, then the LH activity will be low. So that is the third one. So how do these hormone releasing IUDs will function? So they cause an ovulation, which means, as I said, as the progesterone levels are high, so LH activity will get reduced. So thereby the ovulation is being prevented. Second one is hormone releasing IUDs suppress the endometrial changes. So before the implantation has to occur, there are various of the endometrial changes, as we have discussed in the earlier videos. So all those vessels, or it may be thickening of the mucous membrane, all that will be there, which will be there in the regular process of implantation. So all those changes will be inhibited by these IUDs. Third one is thickening of cervical mucus. So near to that of the cervix region, increase in the mucus secretion occurs. So this thickened mucus which is there deposited in that of the cervix prevents the entry of the sperm to enter into the uterus. And the fourth one is insufficient luteal activity. So luteal activity is also being suppressed by the usage of the hormone releasing IUDs. So preferably first one is very quiet without any side effects, but the chances of conception are also being seen. In case of a barrier method, side effects are less, but the effectiveness is also more. But in case of IUDs, which is a widely accepted mode of the IUD, okay, so this has certain disadvantages. So what are those disadvantages? That whenever these IUDs are being inserted by a doctor into the uterus of the female who wants to have a spacing between the first child and second child, so possibly is that these IUDs may act as an irritant. Okay, it may cause irritation in that of the uterine region, or sometimes what happens without the knowledge of the user, if the IUDs are not being exactly fitted, so there is a possibility that they may come out also, and chances of infection are more if they are not being removed after the completion of their life span. So apart from that, one more thing is risk of perforation of the uterus may be even seen when there is a long usage of these IUDs. So generally, in case of these various of the contraceptive methods, what we come to learn is all about that these contraceptive methods will prevent the conception either by preventing the fusion of the sperm and ova, that is preventing the fertilization. Second thing is these temporary methods may cause anovulation, or ovulation process will not occur, or even the implantation can be also prevented by these contraceptive methods. So this is all about today's video, where we have discussed natural methods, barrier methods, and intrauterine devices. Thank you.